What should I expect at a C&P exam for neck pain? A C&P exam for neck pain involves a series of questions to include a physical exam, diagnostic testing, maybe an x-ray if none's ever been done before, and a range of motion test with a goniometer. That's basically teeing it up. That's what happens in the C&P exam. Here's some common questions that are asked at a C&P exam for neck pain. Does the veteran have a diagnosis of a neck condition? Of course you do, because we've been talking about this forever. Diagnosis, symptoms, nexus. If you don't have all three of those, you have no claim. You're going to get denied. So yes, I do have a diagnosis. What's the history, including onset and course, of the veteran's cervical spine condition? When did it start? If it's a secondary condition, it could start anytime after that. If it's a direct service connection claim, that means that you're blaming it directly on your active duty service. Words matter. So that's another question. When did it start? How long have you had it? What's going on? Be prepared to answer that one. Does the veteran report flare-ups of the cervical spine? Does it flare up? I know mine does. I can't tell what my flare-ups are going to be. And then this might be a good idea to keep a log. I talk about, there's an app called Migraine Buddy. It's a good log for migraines. But really, when you're dealing with any pain, you should keep a pain log. Because when you're like, do you have flare-ups? Yes. Well, when was the last flare-up? Like you're in a C&P exam all nervous, like, I don't know, like 10 days ago. If you have a log, last flare-up was 10 days ago. Before that, it was 13 days ago. Before that, it was 19 days ago. A log of any kind, spreadsheet, write it on toilet paper, whatever. You could probably track it in Migraine Buddy. Keep a log when you're dealing with anything that has to do with flare-ups. Mental health is included. Just keep a log. Keep a log of all your pain and all your problems. They're going to be checking the frequency, duration, and characteristics of your flare-ups. So there's you now. You may be having a flare-up at the C&P exam. Typically, that doesn't happen. But they should ask you about it. If they don't, make sure you start talking about it, because you want to talk about your worst day. If you're feeling great, which you shouldn't be in a C&P exam, you want to be talking about yesterday or a week ago, whenever your worst day was. Does the veteran report having any functional loss, functional impairment of the joint or extremity being evaluated on the questionnaire? Is it limited or not limited to repeated use over time? So if you have functional loss, the doctor's going to ask you to describe that in your own words. You should be prepared to talk about this. Is there evidence of pain? If yes, select all that will apply, right? Weight bearing, non-weight bearing, active motion, passive motion. Active motion is, moving your neck. Passive motion is just sitting there. On rest, does it hurt when you rest? Yes, when I lay in bed. Non-movement. So they're going to be checking, if you're just standing up, moving around. If you're standing up, not moving your neck around. Or if you're resting, like laying down, does it hurt there? So they're going to be asking questions like that and filling these things out for you. Be prepared. Get the DBQ for neck pain and study it, because these questions are coming at you. Does procured evidence, statements from the veteran, suggest pain, fatigability, weakness, lack of endurance, or incoordination, which significantly limits functional ability with repeated use over time? This is where you put your personal statement in, talking about your disability before you file your claim. You do all your medical evidence at the beginning. You don't do it halfway through. You already hit the submit button. Now you got to wait for them to make a decision. You don't get to fix it. Fix it and do it right the first time before you hit the submit button. That strategy, that's my boot camp. That's what I talk about. I preach it and I teach it. You need a doctor that can help you with a Nexus letter. Check out my med team. Here's an email address. Hit them up. Tell them you need a Nexus.